reconstruction to be done together with mastectomy is actually very common nowadays. We call that immediate breast reconstruction versus delayed. Actually, when we discuss breast reconstruction, there are two main topics to discuss. One, when do you do it? Two, how do you do it? That's all. Okay? So when do you do it means, do I do it immediately together with the mastectomy, or do I do it a few years later? So how do we choose? To do it immediately, I think, is the choice of most surgeons, whenever possible. Because the patient undergo one surgery. Although the cost may be higher initially, but eventually, over the long term, it is actually cost saving. Patient wake up with a body fully restored, psychosocially, so much better. All right? And to do it immediately, most important is the breast surgeon will coordinate with the reconstructive surgeon to leave behind the most precious piece of skin envelope. And that's how we can reconstruct the breast in as natural manner as possible. Without this piece of skin envelope left behind, the reconstruction in future may not look so nice. But there are also situations whereby we choose to do delayed reconstruction. For example, if the cancer is late stage 3 to stage 4, in these cases, the chance of recurrence can be quite high, and the breast surgeon may choose to have reconstruction done at a much later stage after monitoring the patient for a few years. All right? So after monitoring for a few years, when reconstructive effort is again discussed, this time round, the reconstruction may be a bit more difficult. Because the skin is already very plastered down, we may need to re-expand the skin. So therefore, wherever possible, immediate reconstruction is the choice. Next is how do we reconstruct? Should we use our own flesh or should we use artificial material? Well, artificial material simply means breast implant. For the patient, that is simple, quick solution, cheaper. All right? Recovery, shorter. So obviously this is a very enticing type of, this methodology is definitely the choice of most people if they have not been exposed to what it's like to use natural flesh. Okay? Implant reconstruction long term, we have the problem of hardening. When we say hardening, it's actually the capsule around the implant that hardens. All right? Risk of rupture, and all this may necessitate a change of implant in future. Using the own flesh simply means we are taking our own body excess tissue from somewhere else to reconstruct the breast. And this somewhere else is usually the tummy. Most patients in the cancer age group would have a bit of excess tummy flesh, and they would have even thought about having the tummy flesh removed. That's called tummy tuck. So in this instance, the excess skin is removed from the tummy and is recycled to use to reconstruct the breast. So literally, they have good figure and have the breast restored. This is like kill two birds with one stone situation. So naturally reconstructed breast using your own flesh always look better, more natural. The long-term sequelae, much less. You don't need to think about hardening, change of implant, etc. All right? And obviously, this way of reconstruction also would resist radiotherapy much better. So if there's radiotherapy needed, then implant reconstruction usually land up with a bit of capsular contracture, whereas using your own flesh to reconstruct tend to give better results. But obviously, the choice itself, which choice of implant, which choice of methodology, we probably need to discuss in details with your breast surgeon as well as your reconstructive surgeon.